Welcome to the deep dive. Today, we're going to be diving into a recent research report
Okay.
in the Journal of the Peripheral Nervous System. It focuses on the long-term safety and also the tolerability
Right.
of hyaluronidase-facilitated subcutaneous immunoglobulin 10%, or fSCIG 10%, as a maintenance therapy for chronic inflammatory demyelinating polyradicular neuropathy,
Yes.
CIDP.
This is important for neurologists like you because
Confirmed.
fSCIG 10% offers a potential alternative to IVIg for CIDP maintenance,
Right.
with the added convenience of at-home administration.
Absolutely. And we'll unpack the key findings from the advanced CIDP-3 trial,
Yes.
highlighting the safety data, patient-reported outcomes,
Mm-hmm.
and what these results might mean for your daily practice.
So the advanced CIDP-3 trial is a long-term open-label extension of the Phase 3 advanced CIDP-1 trial.
Oh.
It's the longest extension study ever done in CIDP,
Yeah.
offering valuable insights into the long-term use of fSCIG 10%.
So we're looking at a really robust data set then.
Yeah. Indeed, we have 220 patient years of data
Okay.
from 85 patients,
Got it.
with a median fSCIG 10% exposure of 33 months.
Okay.
That's almost 3 years.
That's a significant amount of time.
Yes.
What does it tell us about the long-term safety of fSCIG 10%?
Well, the safety profile is reassuring.
Oh.
Most adverse events were mild or moderate
Okay.
and self-limiting.
Got it.
Out of 4,406 adverse events,
Okay.
only 48 were severe,
Okay.
and only 30 were considered serious.
That's good news for neurologists considering this treatment option.
Yes.
What were the most common adverse events observed in the trial?
The most frequently reported was headache,
Okay.
occurring in 27.1% of patients,
Okay.
followed by COVID-19 infection in 22.4%,
Okay.
then pyrexia in 20%.
Okay.
We also saw infusion site reactions such as erythema,
Right.
pain, and pruritus,
Okay.
but these were generally manageable in a clinical setting.
Those are all important considerations when weighing the risks and benefits of any treatment. Is there anything else neurologists should be aware of regarding the safety data?
It's worth noting that 16.7% of patients developed anti-Rhph20 antibodies.
Okay.
This is something that might raise concerns about the long-term use of fSCIG 10%.
What are anti-Rhph20 antibodies?
Okay.
And what are the implications of their development?
Rhph20 is the recombinant human hyaluronidase enzyme that's added to the immunoglobulin solution to facilitate subcutaneous administration, like any protein.
Right.
It has the potential to trigger an immune response.
Got it.
However, in this trial,
Yeah.
the presence of these antibodies did not appear to increase adverse events
Okay.
or affect treatment outcomes.
Interesting.
In fact, the rate of adverse events per patient year
Right.
was slightly higher in patients without antibodies.
That's surprising. Does this mean we shouldn't be concerned about these antibodies?
It certainly suggests that antibody development shouldn't be a major deterrent when considering fSCIG 10%.
Okay.
The data from this trial shows that even in the presence of antibodies,
Right.
the safety profile remains favorable.
So this could potentially change how we monitor patients on fSCIG 10%.
Potentially.
Yeah.
This data may alleviate concerns about routine monitoring for these antibodies in every patient.
Okay.
However,
Yeah.
decisions regarding monitoring
Right.
should always be individualized based on the patient's specific circumstances
Right.
and clinical judgment.
That makes sense. Let's move on to the efficacy data.
Okay.
While this trial focused primarily on safety,
Yes.
were there any insights into how well fSCIG 10% prevents relapses in CIDP?
Efficacy was an exploratory outcome in this trial.
Okay.
13% of patients experienced a relapse during the study,
Okay.
with an annualized relapse rate of 4.5%.
Got it.
It's important to remember that this trial didn't directly compare fSCIG 10% to IVIg.
Right.
So we can't make definitive statements about relative efficacy
Okay.
based on this data alone.
So it's difficult to say at this point whether fSCIG 10% is as effective as IVIg in preventing relapses.
Further research directly comparing the two treatments head-to-head would be needed to answer that question definitively. However, this relapse rate is lower than what was observed in the earlier advanced CIDP-1 trial,
Interesting.
where fSCIG 10% was compared to a placebo.
That's an interesting point. Are there other factors that might influence relapse rates
Absolutely.
besides the treatment itself?
Individual patient characteristics like disease severity,
Okay.
prior treatment history, and adherence to therapy can all play a role.
Right.
Additionally,
Yeah.
variations in how patients respond to treatment
Right.
can also contribute to differences in relapse rates.
It seems like there's still much to learn about how best to utilize fSCIG 10%
Yes,
in the long-term management of CIDP.
definitely.
But let's not forget about the patient experience.
Right.
Did the trial provide any insights into how patients felt about this treatment?
The trial collected data on patient-reported outcomes, which can give us valuable insights into the patient experience.
What did those outcomes tell us about how patients perceive fSCIG 10%
Well,
compared to their previous IVIg treatment?
a significant finding was that 84.1% of patients preferred fSCIG 10% over their previous IVIg treatment.
Wow.
This clearly indicates a strong preference for the subcutaneous route of administration.
That's a substantial percentage.
Yes.
Why do you think patients prefer fSCIG 10% so strongly?
The convenience of at-home administration is likely a major factor.
Right.
IVIg infusions typically require patients to travel to a clinic or infusion center, which can be disruptive to their daily lives.
Yeah.
fSCIG 10%, on the other hand, offers the flexibility of self-administration or having a healthcare professional come to their home.
Yeah.
This can save patients time and reduce the burden of treatment.
That makes a lot of sense. Were there any other aspects of the patient experience captured in the trial?
Yes. The trial also assessed patients' quality of life using validated questionnaires.
Okay.
Scores on the SF-36, which measures overall physical and mental health, and the EQ-5D3L, which assesses mobility, self-care, usual activities, pain, and anxiety depression, remained relatively stable throughout the study.
So it seems that fSCIG 10% does not negatively impact patients' quality of life.
That's what the data suggests. In addition, scores on the TSQM-9, a questionnaire specifically designed to measure treatment satisfaction, remained consistently high.
Interesting.
This further supports the notion that patients are generally satisfied with fSCIG 10%.
This is all valuable information for neurologists like myself who are trying to decide whether fSCIG 10% is the right choice for our patients.
Absolutely. This data provides a comprehensive picture of the long-term safety, efficacy, and patient experience with fSCIG 10%.
Before we move on to some of the specifics of the study, what are some key takeaways neurologists should consider when evaluating this treatment option for their patients with CIDP?
The key takeaway is that fSCIG 10% offers a safe, effective, and convenient alternative to IVIg for CIDP maintenance. The data from this trial, particularly the long-term follow-up, should give clinicians confidence in prescribing this treatment.
Excellent.
Now
let's delve a little deeper into some of the specifics of the study. You mentioned that the median 4-weekly dose equivalent of fSCIG 10% was 64 grams. And the median total volume of IgG 10% infused every 4 weeks was 640 milliliters.
Yes, and it's worth noting that this dosing was typically spread across 2 infusion sites. 88.2% of patients received their infusions every 4 weeks, while the remaining 11.8% received them every 3 weeks. The median infusion duration was approximately 135 minutes per dose.
That's helpful to know. Were most infusions administered at the study site or at home?
Initially, all patients received their first 2 infusions at the study site for safety monitoring. After that, infusions could take place at the study site, an infusion center, or, importantly, at the patient's home. In fact, almost 12% of infusions were administered at home.
That level of flexibility could be a significant advantage for patients. Especially those who live far from treatment centers or have demanding schedules.
It certainly could. The ability to receive treatment in the comfort of their own homes could improve patients' adherence to therapy and overall quality of life.
Speaking of safety, you mentioned earlier that only a small percentage of infusions were stopped due to intolerability.
Of course.
Can you elaborate on the types of adverse events that led to infusion discontinuation?
Most adverse events, as we discussed, were mild or moderate. Only 3 serious adverse events were considered to be related to fSCIG 10% treatment.
Could you tell us more about those?
The first was an infection at the infusion site. The second was an exacerbation of migraine and fibromyalgia following an infusion. And the third was an exacerbation of heart failure, which thankfully resolved with appropriate treatment.
Were there any other notable adverse events observed in the trial?
2 patients experienced thromboembolic events. 1 case of superficial thrombophlebitis and 1 case of ischemic stroke. However, both were considered unlikely to be related to the fSCIG 10% treatment.
So overall, the safety profile seems favorable.
Absolutely.
Particularly when considering the convenience of at-home administration.
Yes.
Which, as we know, patients overwhelmingly prefer.
The data strongly supports the long-term safety and tolerability of fSCIG 10% for CIDP maintenance.
Now let's circle back to the antibody development you mentioned earlier.
Okay.
Can you explain why the presence of anti-rhQPH20 antibodies did not seem to impact the safety or efficacy of fSCIG 10%?
That's a great question. While 16.7% of patients developed these antibodies,
Right.
and 2 even developed low titers of neutralizing antibodies.
Okay.
Antibody positivity did not appear to increase the frequency of adverse events.
So it seems that the presence of these antibodies shouldn't necessarily raise a red flag in clinical practice.
Exactly. Clinicians should be aware of the possibility of antibody development.
Right.
But the data from this trial indicates that it doesn't appear to have a significant clinical impact.
This information should help alleviate some concerns that neurologists may have had about the long-term use of fSCIG 10%.
I agree.
Okay. I think we've covered the most important aspects of the safety data.
Yes.
And the antibody issue. Let's move on now to discuss the patient-reported outcomes in more detail.
Sounds good. We can explore how these outcomes can help inform treatment decisions and enhance patient care.
You mentioned earlier that the trial used validated questionnaires to assess patient-reported outcomes.
Yes.
Could you elaborate on these questionnaires and what they revealed about the patient experience with fSCIG 10%?
The trial employed several
Okay.
well-established questionnaires to capture different aspects of the patient experience.
Right.
Firstly, they used the SF-36, a widely used tool that measures 8 health domains, providing a comprehensive assessment of physical and mental health.
Right.
The results showed that patients' scores on the SF-36 remained relatively stable throughout the study, indicating that fSCIG 10% did not negatively impact their overall well-being.
So despite the challenges of living with CIDP and undergoing treatment, patients maintained a consistent quality of life.
That's what the data suggests. Additionally, the trial used the EQ5D3L, a questionnaire specifically designed to measure health-related quality of life.
Got it.
This tool focuses on 5 key dimensions: mobility, self-care, usual activities, pain discomfort, and anxiety depression.
Got it.
Again, scores on the EQ5D3L remain stable, further supporting the notion that fSCIG 10% did not adversely affect patients' perceived quality of life.
This is particularly reassuring, considering that long-term treatment is often necessary for CIDP management.
Indeed. Maintaining a good quality of life is paramount for patients with chronic conditions like CIDP.
Absolutely.
The trial also utilized the TSQM-9, a questionnaire specifically designed to measure treatment satisfaction.
Got it.
This tool focuses on various aspects of treatment, including effectiveness, convenience, and global satisfaction.
Right.
The TSQM-9 scores remained consistently high throughout the study, reflecting a positive patient experience with fSCIG 10%.
This aligns with the high percentage of patients who expressed a preference for fSCIG 10% over their previous IVIg treatment.
Precisely. The convergence of these findings, stable quality of life scores, and high treatment satisfaction provides compelling evidence for the patient acceptability of fSCIG 10% as a long-term maintenance therapy for CIDP.
These patient-reported outcomes are invaluable for neurologists like myself.
Yes.
They provide a deeper understanding of how this treatment impacts our patients beyond just the clinical data.
I agree.
Right.
Patient perspectives are crucial for making informed treatment decisions and ensuring that we are providing care that aligns with their needs and preferences.
So we've discussed the safety data, the antibody issue, and the patient-reported outcomes.
Right.
Now, I'd like to touch on the broader implications of this research. How do you see the advanced CIDP-3 trial findings influencing the treatment landscape for CIDP in the coming years?
The findings from this trial have the potential to significantly reshape how we approach CIDP management. The robust safety data, the high patient satisfaction, and the convenience of at-home administration make fSCIG 10% a very attractive option. For both patients and clinicians, we might see a shift towards fSCIG 10%, becoming the preferred maintenance therapy for CIDP, especially for patients who value the flexibility and independence that at-home treatment offers.
That raises an interesting point.
Yes.
Do you think this potential shift could have any implications for healthcare systems?
It certainly could.
Yeah.
If fSCIG 10% becomes more widely adopted,
Right.
it could lead to a reduced need for clinic visits and infusion center resources. This could potentially translate into cost savings for healthcare systems and greater convenience for patients. However, it's also important to consider the costs associated with at-home administration, such as the need for home healthcare visits or training for self-administration.
Those are all important factors to consider.
Yes.
As with any new treatment modality, careful consideration of both the clinical and economic implications is essential.
Absolutely. A balanced approach that takes into account the needs of patients, clinicians, and healthcare systems is crucial for successful implementation.
Now, before we wrap up our deep dive into this important research, I want to address a potential concern that some neurologists might have.
All right.
The trial did not include a direct comparison to IVIg.
Right.
How should clinicians interpret the efficacy data in light of this limitation?
That's a valid point.
Yeah.
While the trial did not directly compare fSCIG 10% to IVIg, the observed relapse rate of 4.5% per year is encouraging. It's lower than the relapse rate observed in the earlier advanced CIDP-1 trial, where fSCIG 10% was compared to a placebo. However, without a head-to-head comparison, it's difficult to definitively say whether fSCIG 10% is as effective as IVIg in preventing relapses.
So it's important to acknowledge that limitation when interpreting the results.
Precisely. However, the totality of the evidence, including the safety data, patient-reported outcomes, and the indirect comparison with the placebo-controlled trial, suggests that fSCIG 10% is a viable and potentially preferable alternative to IVIg for many patients with CIDP.
This is all incredibly valuable information for neurologists who are trying to make informed treatment decisions for their patients.
It has been my pleasure.
Thank you for providing such a thorough analysis of this research.
I believe this trial represents a significant advancement in the field of CIDP management and offers hope for improved patient care in the future.
I agree. Now, before we conclude, I want to leave our listeners with a thought-provoking question. Given the compelling evidence for the safety, efficacy, and patient acceptability of fSCIG 10%, how do you envision this treatment shaping the future of CIDP management?
That's an excellent question. I believe fSCIG 10% has the potential to become the standard of care for CIDP maintenance therapy, particularly for patients who desire greater autonomy and flexibility in their treatment. We might see a paradigm shift from hospital-based IVIg infusions to more personalized home-based care with fSCIG 10%.
That would be a significant change.
It would. But it's a change that could greatly improve the lives of people living with CIDP.
It certainly would. Such a shift could empower patients to take a more active role in managing their condition. Potentially leading to improved adherence and better outcomes.
Absolutely. And it could also free up healthcare resources, allowing us to focus on other aspects of patient care, such as early diagnosis, comprehensive rehabilitation, and addressing the psychosocial needs of individuals with CIDP.
Those are all essential components of holistic CIDP management. I think we've covered a lot of ground today.
We have.
To summarize, what are the key takeaways from our deep dive into the advanced CIDP-3 trial?
The trial provides robust evidence for the long-term safety and tolerability of fSCIG 10% for CIDP maintenance. The vast majority of adverse events were mild or moderate. And the development of anti-Rh2H20 antibodies did not appear to impact safety or efficacy. This is a crucial finding that should alleviate concerns regarding the immunogenicity of this treatment.
And from the patient perspective, we see that fSCIG 10% scores very high on convenience and satisfaction.
It does.
With the majority of patients expressing a preference for it over IVIg. This highlights the importance of considering patient preferences and quality of life when making treatment decisions.
Precisely. The data clearly demonstrate that fSCIG 10% offers a viable and potentially preferable alternative to IVIg for many patients with CIDP.
This research really does pave the way for a new era in CIDP management.
I agree.
One characterized by greater patient autonomy, convenience, and potentially improved outcomes.
I couldn't agree more. It's an exciting time for both patients and clinicians in the field of CIDP.
Well, thank you for joining us today for this deep dive into the advanced CIDP-3 trial.
My pleasure.
We hope this discussion has provided valuable insights that you can apply to your clinical practice.
I hope so.
And to our listeners, we encourage you to continue exploring the latest research in CIDP.
Yes.
And to engage in thoughtful discussions with your colleagues and patients about the potential benefits and challenges of fSCIG 10% as a long-term maintenance therapy.
Absolutely.
Until next time, keep those brains curious.